joining us today. Good to see you. And a few comments this morning. It should be clear we've really reached a critical moment in the pandemic. Next few weeks, we're going to determine whether we really experience some extreme hardships here locally and across the state, or whether we, for a third time, flatten the curve. We really shouldn't be confused about where we are. We're on an icy road going about 100 miles an hour, and we were tapping the brakes with the most recent actions by the governor to try to slow down. If that doesn't work, we're going to have to even take more serious action or really experience more serious consequences. So I'd like to provide some context about what we're trying to avoid. It's really obvious we're trying to avoid more people becoming sick and dying, but we also want to avoid overwhelming our healthcare system. Right now, all across the country, people are experiencing what we are trying to avoid here. One nurse described her experience in an overwhelmed hospital in El Paso, Texas. She said the sickest COVID-19 patients were put into a room and are being put into a room. She said what's called the pit. No doctors would enter the room to avoid being infected. She said there were standing orders to only try to resuscitate patients 3 times before they're allowed to die. El Paso is also using inmates to help move dead bodies, and they have had to bring in refrigerated trucks to store all of their dead because the morgue has filled the capacity. In Wisconsin, the healthcare system is getting so full that the Children's Hospital in Milwaukee has implemented a plan to admit older patients to relieve the burden on other hospitals. In rural hospitals across the country, many are pleading with larger hospitals to take their COVID-19 patients. Here locally, hospitals in Idaho bring patients into Washington State because they cannot care for them. Many of those rural hospitals were never designed for a pandemic, and it only takes a few infections among workers to have them close. 6 rural clinics in Idaho have had to shut down at various times over the last week because of staffing constraints. We don't want anyone to have to experience that here. We want to make sure that we can take care of our COVID-19 patients and other urgent cases. We can only do that if our medical systems do not get overwhelmed and our frontline healthcare workers stay healthy. We don't live in a different world with different rules and where the virus acts differently. We're all in the same boat. On the good news front, the CDC this week announced that wearing a mask doesn't just protect others, it also protects the person who wears the masks. You know, we shouldn't wear masks because we have to. We should wear them because we want to. And I don't wear a mask because I'm afraid. I wear one because I care. I care for my family and friends. I care for the people I don't know at the grocery store. I care for the businesses that are now shuttered because we didn't take strong enough personal action. And our country is facing the most serious public health threat of the past century, and I care about that, and I want to help. So wearing a mask, washing hands, social distancing are the best ways to keep everybody safe. So we really need to double down on our efforts and get through this third wave. So with that, I'll turn it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers, for those remarks, which provide a stark picture of what could lie ahead if we're not able to change our course here locally. And good morning to the media on the line as well. I'd like to start this morning just by showing you the local situation as I've done in recent weeks. So with your permission, I'm going to share my screen for a moment and just show you some of these slides that we usually do. Are you seeing the slide presentation? Great. So here we are with this now all too familiar curve showing the rolling 2-week case rate per 100,000 persons, and you can see the near vertical rise that rate has taken over the past 2 weeks. And again, that number, so 280, means that for every 100,000 people in Snohomish County, in the 14 days leading up to November 14, last Saturday, in the prior 14 days, there were 281 cases for every 100,000 people, 10 times the targeted rate. Obviously, we all want to be at 0, but the sort of the low incidence target rate is less than 25. So we're 10 times above that, almost 10 times above our baseline previously, and we're increasing 50% per week. So when you hear the term exponential growth, that's what's occurring. I actually like to refer it as explosive, because it's really just taken off, and we're starting to see some of the effects in the healthcare system. Just a little bit more on case reports. Just to give you an idea, the number of cases we're getting reported a day over the past week, several days of 250 or more cases, all exceeding prior historical highs in the first wave and second wave, just completely surpassing that. Some people often say, well, you're just doing more testing and that's why you're detecting more cases. But I assure you, if it was just due to the testing, we would not see the percent of tests that are positive increasing, nor would we see the emerging pressure and stress on the healthcare system that we're seeing. Currently, in Snohomish County hospitals, there are 52 confirmed cases of COVID, 3 suspected. 10 of those 55 people are on mechanical ventilation in the intensive care unit. And that number, that total number of 55, is about a 2.5 times what it was 2 or 3 weeks ago when we were down in the 20s in the number of people in the hospital. And if we don't turn this around beginning immediately, then that 50 will become 100, and then that's definitely where the hospital system is going to be in big trouble, and that means we're all in big trouble too. So this is real, and it's happening before our very eyes, and it's preventable. Other impacts that I wanted to just show you, look at how we had the long-term care cases down just in a handful per week back in September. Now we're up at 20, 30, 40 cases a week in long-term care facilities, and we're also starting to see the deaths rise. So here we are, folks. And I want to come back and stop sharing my screen. Excuse me for just a minute. So other things I'd like to let you know about, just further validating that we've got a serious problem on our hands that could only get bigger if we don't turn it around. Emergency Medical Services has reported in the past week 2 or 3 episodes where the number of calls for COVID-like illness is greater than 95% of the historical highs for calls like that. So the EMS is being stressed, the hospitals are being stressed. I believe that when we hear Dr. Tocher speak in a moment, he can tell us what's going on in the outpatient clinic settings, long-term care. It's all quite concerning. There have been questions we've been getting about Josephine Health long-term care facility up in Stanwood. I just want to acknowledge there have been 99 total confirmed cases in that setting to date, roughly 50-50 between staff and residents, a little bit more residents than staff. 7 of those patients have been hospitalized since the outbreak began in late October. 5 of them have died. The cause is the widespread COVID activity in the surrounding community, making its way into the facility through staff and visitors, just like it happens in all other long-term care facility outbreaks. So while scenarios like this evoke curiosity and draw attention, many other nursing homes have been hit hard by COVID, both in Snohomish County and elsewhere. It serves as a reminder that these settings are highly vulnerable to sustained transmission, that healthcare workers should model best practices for COVID prevention, not only in the workplace, but also in avoiding exposure when not at work. And family and friends, we need to find ways to support our loved ones in these facilities, but, without bringing COVID into the facility. So I think alternatives to in-person visitation are going to be our mode of interaction with our elders in these facilities in the immediate future, at least. The health district is very hopeful that the new restrictions announced by the governor on Sunday will help turn this massive wave around. Even if we stop now, there's going to be some increase in hospitalizations because the cases that are happening today won't be hospitalized for a couple weeks. They've already been infected. So we will only begin to see benefits of this this change in requirements 2 to 3 weeks down the line. So we both need you to act quickly and be patient. It's going to take a while to reap benefits. These restrictions have not included K-12 schools, with the exception of indoor sports practice and fitness programs, which are restricted both inside and outside school settings. This has led to a number of questions about our recommendation for schools here in Snohomish County. Those recommendations remain unchanged and aligned with guidance from the Washington State Department of Health and the Office of the Superintendent of Public Instruction. Data collected in Washington show that while cases and small outbreaks have occurred in schools, transmission of COVID-19 has been limited in the school setting and is not contributing substantially to the community-wide transmission we're seeing. Certainly, as cases in the community increase, we will also see more kids and staff showing up at schools with COVID, but plans are in place to prevent and control that, and I'll talk about that a little more in a minute. Our state has established rigorous health and safety requirements for schools. These include all 5 key mitigation strategies recommended by CDC and the Department of Health: face coverings, distancing, increased hand hygiene, increased cleaning, and also a 6th one would be screening at the front door. When kids come to school, when staff come in, screened for symptoms of COVID or exposure to COVID, and excluded if they answer yes to any of those. We have said, and the state has said from the beginning, that our decisions would be data-driven. At this moment, the data don't point to schools being the source of increased transmission in the community. That being said, as I mentioned, the high level of transmission currently in the community will lead to more cases becoming apparent in the school environment, highlighting the ongoing importance of our measures to prevent and interrupt transmission in those settings. We also know that in-person learning has social and emotional benefits for the young learners that currently outweigh the communicable disease risks. Modeling studies, results elsewhere, and our own experience here collectively show that the health and safety measures being taken seem to be effective at limiting the spread of infection in the school setting. These settings are far different from settings with people getting together for social gatherings in private homes, not wearing masks, and so forth. We will continue to work with the schools and to apply existing Department of Health and Office of Superintendent of Public Instruction guidance regarding the learning environment. And as the government stated, at this moment, the data does not suggest that school activity is contributing to the surge we are experiencing. The Health District will continue to support schools in providing guidance to inform their decision-making and in taking steps to interrupt transmission in the school setting when it occurs. Again, we hope and anticipate that new statewide restrictions will make great strides in easing the strain on our healthcare systems and bringing these numbers down. But frankly, where we need the biggest trend reversal is by residents in their personal actions. We need you all to take to heart what a dire position we are in and how your actions impact our efforts as a whole in Snohomish County. This means that much like much of this past year, holiday plans and get-togethers will need to look very different from years past. The Health District has released guidance last Friday on our website on how to give thanks, not COVID. Indoors, masks off, and lots of talking. That's the perfect environment for generating the clouds of airborne droplets that lead to transmission. Social gatherings with non-household members is not only too risky for attendees, but could cause unnecessary strains on the healthcare system. More than strain, really overwhelm it if we keep going in the direction we're going. We're at a critical point where we still have the opportunity to reduce or prevent an overwhelming surge of demand on our hospitals, which are already under stress. And I imagine that will also extend to outpatient facilities as well. While the need to resort to the restrictions in place is regrettable, the health district supports them as a necessary step in slowing down the tremendous momentum this virus has accumulated over the past month or two. This is all preventable, but we need your help and we need it now. I urge all of Snohomish County to respect and follow these restrictions in good faith. Thank you, and with that, I'll pass it along to our colleague, Dr. Tocher from Community Health Centers of Snohomish County.
Thank you, Dr. Spitters. I want to begin by saying what good partners Snohomish Health District has been to us in the community, particularly Dr. Spitters and Sean Frederick, the administrative officer. So we're very grateful for their support and cooperation during this. My name is Tom Tocher. I'm the Chief Medical Officer at Community Health Center Snohomish County. We are a federally qualified health center. We have 7 locations throughout Snohomish County in Arlington, Edmonds, Linwood, and Everett. We have 7 medical facilities, 5 dental facilities, and 5 pharmacies. We also provide behavioral health and medication-assisted treatment for opioid use disorder. In fiscal year 2020, we provided over 250,000 visits to over 67,000 individuals. We serve a largely low-income clientele, predominantly Medicaid, Medicare, and uninsured. Over 85% of our patients are at or below the federal poverty level. So again, a very in need population, a very diverse population. About a third of our patients speak another language besides English at home. As far as the impact of COVID-19 on our practice, we've seen a dramatic increase in the last 2 or 3 weeks in our volume, particularly at our Everett Central walk-in clinic location. Normally, we would run across the organization about 200 COVID-19 tests per week with about a 4% positivity rate. In the last week, we've run 500 tests with an 8% positivity rate. Normally, a provider in the walk-in clinic would see around 20 to 25 patients per day. The past few weeks, it's not been uncommon for them to see 50 patients per provider per day. So a dramatic increase in our visit volumes. And much of this is driven by COVID-19. These are not worried well people. Again, with the the increased positivity rate, it's not just because we're doing more tests. These are people who are either ill or who've been exposed. We had one business owner who brought in all 30 of his employees. So you can imagine that created quite a strain on our facility. Again, because we're a healthcare facility, most of our clinics are continuing with their current protocols. However, we have tightened up on social distancing, and our administrative office is tightening up our work from home interventions as well. I just want to say again, Chris can speak to this more elegantly than I can, but the virus is, it's obviously spreading. This is very concerning, both in the inpatient and the outpatient settings. We're concerned that our facility will not be able to keep up if the curve does not flatten out. The virus is a force of nature. It's like the rain or the wind. We can't stop it from being around. We can't protest. It's going to spread, and we need to do everything we can to prevent that spread, to interrupt that spread. Obviously, people want to get together. We've been dealing with this for months, and it's no fun to wear a mask, to social distance, to not see people that we care about at the holidays. But I would ask, every time you think, well, what's the harm of having a gathering? What's the harm of having some people over? The harm is that you could transmit this to somebody else and get them either very sick or they could die. And about 40% of cases are asymptomatic. So people all need to act as though they have COVID-19 themselves. The Institute for Health Metrics and Evaluation at the University of Washington estimated that 130,000 lives could be saved between September and February if everybody wore masks. So again, not a particularly glamorous intervention, Not very exciting, but very, very effective. Yes, hope is on the way with the vaccine, but we can't wait for that. We've got months before the vaccine will be in widespread use. We have to do social distancing, hand washing, avoiding crowds, and staying home when you're sick in order to bend this curve back down to a manageable level. Thank you very much.
Thank you, Doctor. So we'll go through the questions now. We've got one up, probably for either of you. The White House Coronavirus Task Force is recommending the Abbott Binax Now test to routinely test teachers. Is this rapid testing widely available? The school administrator within school teaching says she's told there's a supply locally, but it can't be distributed yet. Can you address this? Dr. Spitters, maybe I'll turn to you first.
Yeah, so this Binax Now test is a very low technology, I suppose in a way it's high technology, but it's low demand. It's something that someone with very limited training and skills can complete in 15 minutes at the point of care or at the point of testing. And so that's its advantages. And it's currently got an emergency use authorization from the Food and Drug Administration for the testing of people with COVID symptoms. It's a little less sensitive, a little less able to detect COVID than the standard PCR test, but its advantage of timeliness and ease at the point of care does carry some advantages. So the federal government has distributed hundreds of thousands of these kits out to states and then onto the counties. We're working with local partners to find the proper settings for that. And then with respect to the schools, you know, it's I'm a member of a work group that's putting together guidelines for testing to address schools, sort of to kind of lay out the science and the options. That process is still underway, but we should have a product within, I think, a week or two to share with the schools and all of our community partners. Having said that, testing of asymptomatic individuals is not prohibited by the emergency use authorization, but it is an off-label use, meaning it's not one that it was approved for. That still can be okay, but it has to be done with great forethought and driven by data and expert guidance. So one thing to keep in mind is that just 10 days ago, we saw a modeling study released from the Institute for Disease Modeling in Bellevue that works in collaboration with the Gates Foundation and the Department of Health, showing that the impact, the key impact that we need to have on schools are those measures that I've mentioned. And testing has a much lower secondary impact. So this test may have a role in schools, and it may not be the same role in different schools or different communities. There are a variety of ways of looking at it. But the go-to method for keeping our schools safe, where we are providing in-person learning to young kids, is by just sticking with those standard measures, face coverings, screening at entry, keeping things spread out, hand hygiene, etc. And testing in some settings may provide some additional benefit, but it's not the cure-all for interrupting community transmission.
Tocher, anything to add? Okay. Okay, the next question is really three questions. I'll just read them all and I can address them. Is the health district concerned that some businesses won't comply with the new order? Have you received any complaints about that? And also, contact tracing has really dipped. Can you talk about the effect that has on stopping transmission? And finally, how does a government agency get 14 cases if most buildings and facilities are closed?
Okay. Well, I think the general theme that these questions raise, maybe there's two themes. One, it relates to enforcement of the governor's restrictions. Again, this is not an exercise in assigning blame. This is a effort to interrupt transmission and appeal to people's good senses, whether it's individuals in the community, proprietors of enterprises of any type, is to look at our, enlightened self-interest as individuals and as a community. Our ability as a health district, we don't have badges and handcuffs. It's one thing to, if there's a single uncooperative tuberculosis case in the county, we can take legal action to control that. But if there's widespread disregard for basic public health measures, the health district can't overcome that failure of will. And so I think we just need everybody to try to pay attention and respect these restrictions in good faith. And yes, as transmission becomes more widespread, the capacity of the health district to interrupt that transmission becomes more and more limited. We're actually doing more case investigations and more contact notifications in terms of numbers of people reached than we have in recent weeks, but the percentage of total cases and contacts is lower because there's just so much out there. So much like the healthcare system, the public health system is being stressed as well. And that is a fact of the situation. And the only way for us to get out of all of that is to respect the restrictions, demonstrate enlightened self-interest and community, benefit of the general community, and get with it and pay attention and start following these guidelines.
There's a couple of questions about Josephine. Has the health district identified any lapses in infection control at Josephine Caring Community? What is being done to care for residents at Josephine and prevent further infections? And then there was another related question. Dr. Spitter said 99 tested positive, 7 have been hospitalized and 5 have died. If I heard correct, those hospitalized were all residents, or were any staff hospitalized?
1, I don't know. 2, if I knew, I wouldn't tell you, because that number is so small it could potentially identify a staff member and therefore would be a violation of federal privacy laws. So can't help you there, I'm sorry. But the majority of the staff tend to be younger and the residents older. So the majority, if not all, of those hospitalizations and deaths are presumably resident related.
All right. Do you think people would take the virus more seriously if they knew which restaurants, businesses, and other organizations were dealing with outbreaks?
I can't answer that. I don't have a good answer to that. I just think, look, restaurants, people come, they sit down, they're indoors, off come the masks, and there they sit talking in an indoor environment for extended periods of time. So that's a sizable social gathering with other tables around. Even with distancing, some of those droplet clouds can remain suspended for hours. So indoor settings with masks off is just not something that we can that our overall society can tolerate at this time, with due sadness and compassion for the restaurateurs. This is an incredibly difficult blow for them. But we really don't know what else to do. And we're not alone in this. All across the country and the world, at moments like this, closing down virtually all indoor gatherings in public spaces is part of the recipe for trying to navigate out of the vortex we're in.
Just to add to that, if we tried to chase down individual institutions, it would be like whack-a-mole. By the time you identify something, it's moved on. This virus is only transmitted one way. It's from somebody that's got it coming in close contact with somebody that doesn't. And that can happen in a restaurant, it can happen in a business, it can happen anywhere at any time that people are getting together. And so it really isn't related to a particular business or organization or office building. It's people walking around and moving around. So, the actions the governor's taken now are intended to restrict that, keep people more socially distanced. So it would really be a wrong approach, punitive to businesses, because it really isn't related to them. It's related to people coming together. So I think that would be really a wrong-headed approach. Earlier this month, you mentioned having some problems with churches having large services. Has the county and the health district contacted these churches, and are the large services still happening? And if the services continue, what can the county do? Well, first of all, they are being contacted as best we can. I have not received any complaints here lately. Perhaps the health district has. Dr. Spitters, would you like to address that?
Well, we occasionally, get reports from the community about large gatherings and faith-based organizations. We try to reach out to them and educate and encourage, and some are more responsive than others. Again, this is a zone where, involuntary enforcement of common sense requirements, is not really in our toolkit. And so we really need, the solution to that is to, we try to educate, try to encourage, try to maintain a relationship with these folks. But at the same time, my message to the community is don't attend those gatherings. And if it doesn't lead to your illness and demise, it may well lead to someone else's, like Dr. Tocher mentioned. So we're doing our best with those, but we're not empowered to, go close down churches. It's just not what we do.
There was a question received at the Joint Information Center. At what point do infections eclipse the capacity to test in Snohomish County?
Who knows? Maybe we're there right now. Where in general, if you look across communities, there are the number of people who have antibodies, over the long haul, the number of people who have developed antibodies to COVID is about 5 times the number that have been tested positive and reported. So not everyone who's infected and ill or infected and not ill is getting tested, counted, and intervened on. We're all doing the best we can to reach those that we can and maximize our testing capacity. This is a situation, as in many communicable disease control interventions, where multiple imperfect interventions like testing, like wearing face coverings, like social distancing, all those are imperfect, but you stack them all together and you can create a substantial barrier to transmission of the virus. So that's our goal.
Follow-up question on schools. 39 students and 3 staffers are in quarantine from Monroe Public Schools. Do we know how many have tested positive? And are there outbreaks outside Monroe School District? And as officials insist, data suggests younger kids should move into in-person instruction. Should children, in fact, carry the virus and do not exhibit symptoms, what is the advice for their families who might share concerns they be required to gather in classes?
Well, again, the first question is, yes, there was an exposure in a Monroe School District setting where several dozen kids were, and probably a couple of staff members were quarantined. And again, because of the, one, I don't have an answer to, how many have been tested and what the results are. Testing in that situation is not mandatory. If they're ill, we try to make sure they get tested. If they're well contacts, we encourage testing, but we don't require it. And then they serve out their quarantine and then resume life. But if, given that that school is known and that it's small numbers, if I told you 1 or 2 tested positive, which I don't know. Again, that's a very small number in a focal community. It could identify someone. It violates our what's called the small numbers policy that we share with the State Department of Health, and that is developed to respect federal and state privacy laws. So I can't answer you there, but we do routinely report on school outbreaks. There are many clusters of, I think we've got roughly half a dozen schools with one or more cases in them. I think it's 2 to call it an outbreak. So these are often clusters, not uncontrolled outbreaks. And we're finding that we're able to interrupt transmission and with the basic measures that have been discussed, as well as the quarantines when cases do occur. Regarding school officials and their decisions about in-person learning, again, the focus is on the youngest learners and high needs learners, where the benefits of the on-site services for learning are balanced with the benefits, other benefits and risks. And that is an educator decision. The health district provides public health perspective guidance to them in that. And again, I'll just restate what I did in my comments. To this point, schools do not seem to be exacerbating the community-wide transmission that we're seeing. I think they're more of a bystander in it. And then we have the measures in place to try to limit that when it occurs. We're not going to have 0 cases in schools. There will be cases in schools all throughout this till it's over. The idea is to contain.
So one last follow-up question on Josephine. Did the health district identify any lapses in infection control at Josephine, and what is being done to care for the residents there?
Well, no, I'm not aware of any, gross negligent type problems that they had. Somehow an ill staff member or an ill visitor got in the building and it spread to a patient presumably, and then it's very difficult. Even we're seeing this with many long-term care facilities, that even with good infection control precautions, it's hard to interrupt the spread of this virus in close congregate settings like long-term care facilities. And so they're doing their best. We're doing our best to help them. And they've been very cooperative. And how are they cared for? If they get isolated from the other patients, if they've got COVID, if they've been exposed and aren't sick yet, they're put in another section, trying to separate out everyone, and then maintain good sort of physical and operational barriers between all those folks. If they get sick and they're not so sick they need hospitalization, they're just cared for in place there. And if they get sick enough to where they need hospitalization, then they get transferred to a hospital.
Thank you, Dr. Spitters. Thank you, Dr. Tocher.
Thank you, Executive Summers. Thank you, Dr. Tocher.
Hey, thanks for having me.
And thank you, everyone. This is Carrie in the Joint Information Center. It looks like we've wrapped up our questions. Thanks for sticking around a little extra time today. We're going to go ahead and wrap up now, but please do stay tuned for future media availabilities. Thanks.